This is Dr. Schuster with your tip of the week. Today we're going to talk about medications. Now, you know I like aspirin. Aspirin prevents heart attack and stroke. So most of my patients are on aspirin. Now, there was a scary study that came out of Belgium that found that aspirin increases your chance of bleeding. Now, we know that, but the numbers get worse as you get older. So if you're under 65, the chance of bleeding from aspirin is very small. But if you're over 85, the chance of a life-threatening bleed is 3 in 100. So here's my new recommendation. If you're under 75 and you're taking aspirin to prevent a heart attack or a stroke, go right ahead. If you're over 75, still take your aspirin, but take a Zantac or a Pepcid along with it to protect your stomach against serious bleeding. We talk about alternative care preparations. There was a study using chondroitin sulfate for arthritis, and this is what you can get in a health food store. And they found that it's more effective than Celebrex for arthritis and has much less side effects. That's the good news. The bad news is this was using pharmaceutical grade chondroitin that you can get in Europe with a prescription, but in the United States you can't get it, and the amount of chondroitin that's in health food formularies isn't enough to really work. So maybe one of these days we'll be able to get pure chondroitin and use it for arthritis. Along the same lines, there was a study came out of China that some of the herbal medicines that they use in China do work for hypertension and prevention of heart disease. The new diabetes drugs are good. They can prevent heart attack and stroke, and the old diabetes drugs are good. Metformin has just been shown to prevent coronary artery disease in pre-diabetics. So please review your diabetes medication with your endocrinologist or your primary care physician. So this is your update on different medications, but remember, diet, exercise, don't smoke, and then you won't have to take a lot of pills.